Okay, so I treat the patients with kidney failure. They come in 3 times a week. I monitor their progress, and it's involving education as well when they come in for dialysis. We check their bloods and their well-being each session, and we see how they are. If there's any alterations to be made in their treatment plan, we do that as nurses. I link with other members of the healthcare team, consultants, the dietitian, physios, regularly throughout our day. We assess the patients. We education not only for the patient but also the family, because renal failure, it encompasses patient and family. We provide some support for them, so if there's any problems, they've a chance to talk to us and we resolve it if we can. If not, we'll involve other members of the healthcare team, and if there's any other investigations that need to be done or treatments that can be offered to the patient, we sort of organise that for them as well. So the treatment of patients with kidney failure, they come in to the hospital 3 times a week, and they're connected up to the dialysis machine, and the blood is taken out of the patient and is pumped around an artificial kidney. The artificial kidney removes the waste products from the blood, and we can also take waste excess fluid off on dialysis, called ultrafiltration. The rest of the functions of the kidney, the patient has to look. We monitor them through bloods. So for their hemoglobin, we can supplement that through an artificial means by giving the patients injections. We monitor the patient's blood on a monthly basis in our unit, and according to the guidelines written up by the consultant, we can adjust the amount of drug to maintain the hemoglobin accordingly on an individual basis. The rest of the products, like calcium and the phosphate, again, we monitor the patient's bloods, and we can adjust medications to help control those levels. For the blood pressure, we maintain the patient's weight, so we can remove excess fluid through the machine, and that will help maintain the blood pressure. And also with medication, blood pressure and cardiac function can be maintained. Ideally, with the correct weight of the patient, achieving the dry weight, we can reduce the amount of medications that they need to take to help protect the heart and maintain the blood pressure. You feel sadness that if it's a young person, they're coming in here 3 times a week, you know it's a harsh treatment. You can see them possibly getting sick on dialysis, and you know that it's the only way to get out of this vicious circle is through getting a kidney, and at the moment it's a bit difficult to say how long that could be. Also, patients can be quite good on dialysis, so it's not really a hardship for them, but at the same time we're still worried that the longer they're on dialysis, the harder it could be for them, and they could potentially get sick, or worse, their condition can deteriorate. So it's a worry as well. The emotions are sadness, shock if it's sudden, and if it's a younger person, can be sometimes if it's an elderly patient who's been through a hard time on dialysis, it can be a relief. You see patients coming in, and you know that they don't like coming in, and you're putting them in this harsh dialysis treatment, which you know takes a lot out of the patients. And once they pass away, you know it's a bitter. Their suffering has finished. They don't have to come in anymore. These patients, they come for us, and they're usually quite sick once they commence on dialysis, and you can see their improvement they make over the period of time with us. They can become more outgoing, and their own personality comes through, and you can see that blossom. And also from social interaction with other patients, you can see they become real part of the dialysis family, as it were. So you do miss them, and especially in our unit we do primary nursing, so each nurse is a group of patients, so it can be, if you get to know them really well, it can be like a loss of a family member, so it's quite hard to take. And I suppose you do mourn in your own way that this patient has gone, and because it's such a high turnover of patients, you don't really have time to mourn the loss as such. Like one day they're here, the next day they're sort of gone and there's a new face in their bed already, so it's hard, and you must respect their own individual interests, and you must respect the family and also the rest of the other patients involved. Not only do they develop a bond, but they will develop, other patients develop a bond, so you have to be wary of those patients as well and give them an opportunity to mourn and to grieve as well, like any normal grieving process. They have to go through it as well. Our unit, it's usually about 3 or 4 patients a year, and it can be, they'll either come in a group together, or it can be spread out over the year. It's very hard to tell when the patients will come, but last year was the last patient we had. About 6 months ago, I suppose, the last person we had as a transplant here, so it varies. Organ donation to increase, you would need support, because when you have to request or ask the relatives, it's in the worst experience, time of their life. It's usually a young person who's had a serious injury or a serious trauma or something like that, and you have to broach the subject. So you need support there, media awareness, sort of get away from that taboo that it is there and it's a fantastic opportunity, or it's a fantastic service that can be availed upon. And it's just through the goodness of the family's heart, really, and their decision not to be taken lightly, and it's not to be, I suppose, not to be abused, that they're being asked in this awful time experience of that family, and to provide the support not only for the staff but also for the family as well, and to explain the process. Education, you see more of it coming up in the media at the moment, but I suppose they need more education of what it actually involves. Like, their whole quality of life improves greatly. They don't have to come into the hospital 3 times a week. They're not connected to the machine. Any sickness that they had when they're on dialysis is going out the window. They can carry on normally as they want, as they did previously. They can enjoy family holidays, family gatherings, parties. There's no restrictions on them, because that's the greatest gift they get. Any restrictions from their diet and their fluids or whatever is gone. They can do what they want to do when they want to do, and their times, they've plenty of freedom to do what they want to do, and they can arrange trips without having to consult the nurses or the hospital and for us to organise it. The fear of being connected to the machine is gone, so they don't have to do that anymore. They can spend more time with their family. They can continue on with back to their normal activities of daily living. Usually after the initial transplant, and once they get over that time, they have a completely different outlook on life. They're more outgoing, they can do all the activities they ever wanted to do. It's great for the family that they can join with the family and do everything. Holidays and trips abroad. And for a lot of the patients, the biggest joy of getting the transplant is they can actually drink what they want to drink. There's no restrictions on their diet or their fluids or anything like that. And they just live a good and healthy life. And it's great to see. There's no worries for them, and they're going to do well. So it's good for them.